Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about deep vein thrombosis, or DVT for short, which is a big issue, especially amongst the patients post-op, undergoing surgery, patients who are immobile, chronic illnesses, and bedbound. DVT can lead to a common complications called pulmonary embolism, which is a life-threatening. The signs and symptoms of DVT include asymmetrical edema, asymmetrical cough, swelling, and asymmetrical localized pain in the cough. There can be signs and symptoms of pulmonary embolisms as well, which is again a common complications of DVT. Joining normal leg on the left here, we have a leg with a DVT. The leg with edema on the left is swollen, has edema with erythema, and is warm. So deep vein thrombosis, as the name implies, means thrombus forming with the deep veins. So let's look at the normal vein of the legs here. A normal vein of the legs have valves which assist in hemodynamics of the veins. That helps return blood back to the heart by preventing backflow. In deep vein thrombosis, there is a thrombus occurring within these veins of the leg, the lower legs usually. And so clotting is occurring as a thrombus is made up of a network of fibrin mesh, platelets, and red blood cells. They all clump together via coagulation and cascades and forms what's known as a thrombus. There are many causes of deep vein thrombosis or thrombus formation, but it can all be condensed to three things. And these three things are factors that makes up what we call the virtuous triad. And the virtuous triad includes vessel injury, number 1, venous stasis, number 2, and hypercoagulability, number 3. Different diseases and conditions lead to one or more of these factors, and this will predispose one to developing deep vein thrombosis. And so once a thrombus has occurred, the thrombus itself has a few fates, including propagation, which means just growing along the vessels, organization, organizing within the vessel layer, recanalization, forming holes within the thrombus, and embolism, which means dislodgement of the thrombus, allowing the thrombus to travel around the body via the blood. End or resolution, the thrombus just gets broken down by a plasmin, a factor that we have in our own body. But we will mainly focus on the embolism, because it is a common fate of the thrombus in a deep vein and can be life-threatening. When a thrombus dislodges and becomes an embolus, it can travel up to the heart via the inferior vena cava, and the heart will then pump the embolus to the pulmonary circulation. The embolus can then lodge into the pulmonary arteries, causing what's known to be as a pulmonary embolism. And this can subsequently cause pulmonary tissue infarct if it's big. And so pulmonary embolism is a big complication of deep vein thrombosis. Another big complication is actually the side effects of the medications people take who have deep vein thrombosis, and these medications, they can cause acute GI bleeding. Because the medications are anticoagulants, the risk factors for developing deep vein thrombosis essentially will fall into one or more of the virtuous category. Virtuous triad category, and these risk factors include pregnancy. Now, pregnancy can cause or as risk factor to DVT, because when the uterus enlarges, it can press against the inferior vena cava, causing stasis below. Also in pregnancy, there is a rise in clotting factors. Other risk factors for developing deep vein thrombosis include increased age, obesity, malignancy, having had a major surgery for the past 3 months, having medical comorbidities, being hospitalized in the past 2 weeks. And for patients who are hospitalized, 25 to 50% of actually surgical patients can develop DVT, and also many non-surgical patients. Other risk factors for DVT include being on a certain medications such as oral contraceptive, tamoxifen, being on a long distance flights. Genetics also plays a role in decreasing the risk of DVT. Genetics including antithrombin gene mutation, protein CNS deficiency, and also antithrombin deficiency. Investigations for deep vein thrombosis include a full blood count, liver function test, electrolyte urea creatinine iron, imaging, including venous duplex ultrasound, and imaging can also include images for the chest in suspicion for pulmonary embolism. Imaging includes venous duplex ultrasound, and imaging can also include imaging for the chest in suspicion for pulmonary embolism. There is another investigation that can be done based on the coagulation cascade. Let us briefly go through the coagulation cascade. There are two pathways in the clotting cascade or coagulation cascade, which is the extrinsic pathway and the intrinsic pathway. Both the extrinsic pathway and the intrinsic pathway will lead to a common pathway, which is the activation of factor 10 to factor 10A. 10A in turn activates factor 2 or prothrombin to factor 2A, which is known as thrombin. Thrombin then activates fibrinogen to fibrin. Fibrin forms the basis of the fibrin mesh and is the last step in the formation of the thrombus. So now, the thrombus is formed. However, things can also break down the thrombus. These things is plasminogen or plasmin. And plasmin leaves the fibrin, creating what is now called a D-dimer. During active thrombosis, there is elevated D-dimers. And so the measurement of a D-dimer can give some indications of coagulation activity that is occurring in the body. However, saying this testing for the D-dimers is not very specific for the deep vein thrombosis, as elevated D-dimers also occur in a number of other conditions, including pregnancy, as well as post-surgery, and so measuring the D-dimer is often not useful, but sometimes it is useful in ruling out pulmonary embolisms or deep vein thrombosis. Let's move on to management, which is mainly anticoagulants. And essentially, the anticoagulants include heparin. And there are two types of heparin that can be given, which is low molecular weight heparin, which is given IV or subcutaneous unfractured heparin, who have deep vein thrombosis, and these medications, they can cause acute GI bleeding.